You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week I'm really pleased to have joining me Dr. Julie Militello, who is a preventative MD. She practices in Baltimore, Maryland, kind of close to where I am, so I'm really excited to have her on the show.
Thank you so much for having me.
You're welcome. We're going to have a good chat about preventative medicine. We might touch a little bit about bone health and all things. So thanks so much, Julie, for being here.
Thank you so much.
Yeah. So can we start by sharing kind of your story into medicine and kind of what lights you up about what you do?
So I am a board certified internist. I moved to Baltimore in 2016 with my family, and I really started my practice focusing on prevention. What was important to me, what was important to my patients, and that kind of just changed the trajectory of where I was headed. In 2019, I decided that the traditional model was no longer for me, and I had my third child, and I sat back and I said, what was really important to me? And I ended up having a fourth child, and it took a little bit of my time, so I really got to focus on motherhood, which I was really, really excited about, because my first two children I did have during my busy time being a physician. And I had my fourth child, and I bought a rheumatology practice located in Carroll County. And that really sparked my interest again in medicine. And I got to see a side of medicine that I didn't exactly see before. And so in 2020, we bought the practice, and I started thinking about how do I get back into medicine? And prevention has always been the mainstay for me. So this year I went ahead and opened a vitamin infusion suite, and I'm really excited to get back into medicine this upcoming year.
Awesome. Yeah. Thanks for sharing. I love hearing people's journeys and kind of what they want, but it's so great. You have 4 kids, right?
It's crazy.
It's crazy. It's crazy. 4 kids. And you were practicing internal medicine prior to that.
Yes, always practicing internal medicine. And plan is to reopen my book and accept a handful of concierge patients in 2025.
Oh, that's fine. So let's talk a little bit about you mentioned in the rheumatology practice, you were seeing a different side of medicine. Talk to me a little bit about that.
Well, in rheumatology, as a board certified internist, I really wasn't exposed to that. My husband is a rheumatologist. So as I got to see that side, I saw a lot of common conditions. What are we experiencing as a population? And one thing that stood out to me was bone health. And I'm seeing a lot of patients suffering from the damaging effects of osteoporosis and osteopenia and overall joint health and the degradation of those joints. So I started really focusing on what are we doing here? What are we doing wrong here? And what can we do to prevent us from getting there?
Yeah.
It changes your life.
Let's talk about that. Can you answer first? Like, what are we doing wrong? Why are so many women getting, I guess mostly women.
Yeah, it really is everybody, but you're right. It is mostly women. So osteoporosis is a preventable, in most cases, disease. It's silent. So most patients don't even know about it until they fracture a hip. And your risk of mortality, your risk of dying once you fracture a hip is pretty significant. So we have about 1 in 2 women postmenopausal will develop some sort of bone disease, and 1 in 4 men. So we'll see it age. Number 1 risk factor will be age. Your peak bone mass is about 30 years old. So we're building bone and breaking bone at the same time. Bone is a very dynamic tissue. So once you hit 30, you have the most dense bone mass. After 30, that declines. So age is 1, your sex. Females are more affected than men. Postmenopausal women especially, because of the drop in estrogen that is protective for the bone. Lifestyle. We have smokers, alcoholics. Excessive caffeine use can also inhibit your ability to absorb calcium. So all these things play a role. And overall lifestyle.
Yeah, and I would argue too, gut health is a really big
one. Absolutely.
We treat a lot of patients that come in with all these digestive disorders, and that will put you more at risk because of what you mentioned earlier about the caffeine. If your gut is not absorbing properly, you're not going to absorb maybe the supplements and or the calcium that you're consuming in your diet. You can take all the supplements you want, but if you don't absorb that, your bone's going to steal, or your body's going to steal that calcium from the bone. And it's because your heart muscle has to have calcium at a very regulated, right? It can't go above the calcium level or below, or the heart muscle doesn't work properly. So it's very important for the body to keep the blood calcium levels very in that range.
In that range, absolutely. I mean, especially even calcium levels can affect arrhythmias.
Yes.
Too much calcium or too little calcium. So it's really, really important. Unfortunately, our bones do suffer if we don't supplement or get our diet enough in our diet.
Yeah. Yeah. So clearly, like, we're much higher risk. Is the incidence of osteoporosis a lot higher than it was, say, 30, 40 years ago?
Our ability to pick it up has become better.
Oh.
Yeah.
Do you
so
think that's what it is?
Yes, I think so. Of course, yes, there's some factors that, smoking or alcohol, but I think our ability to pick it up, and people are more aware of the disease now.
Yeah. Interesting.
Yeah.
So we talked about, risk factors. Talk to me about some of the things you guys offer in your practice for prevention. Like, what do you talk about?
Things that we talk about is free for you to do at home. We really don't need to come to our office. The biggest thing I push right now is exercise. Mm-hmm. We're talking weighted vests. We're talking resistant training.
The weighted vests are such a thing right now, right?
I love the weighted vests. I want everyone to get one.
Do you recommend them for people?
Yes, everybody. Okay, so let me talk about the weighted vests.
Yes.
Weighted vests don't need to be worn all day.
Okay.
I would say 30 minutes. You don't have to wear it every day.
Yeah.
But you can wear it as doing something simple as walking.
Yeah.
Your weighted vest, 10 to 15% of your body weight.
Okay.
So it's not going to be too heavy. You wear it for 30 minutes, and it has shown to have a 2 to 4% increase in your bone density.
That's fantastic.
I mean, and it's so simple. Everyone
can
do it.
And also get you in better shape,
It gets you in better shape. It increases your axial load, and patients do reap the benefits of the weighted vest. I love it. But we can also do things like weightlifting.
Yeah.
We can do resistant band training. That is probably the simplest things you can do. And you're not, at 30 years old, you're really not thinking about your 70-year-old body, but you should be.
Yes. Because that's when you're when you're forming your 70-year-old body, right?
Exactly. You're absolutely right. So you're not working for that hot summer body. You're not. You're working for that 80-year-old body who's trying to push that shopping cart.
But you may also get a hot, summer body in the meantime, right?
Body. I tell especially my females, this misconception that I don't want to get too bulky. It's not that easy. Trust me.
Yeah. You might, if you were someone that builds muscle mass quickly, you might bulk up initially, but then you'll slim down.
Yes, and I mean, I think it looks great, to be honest. My goal is I lift 5 days a week. I wish I was bulkier than I am, but I am not. So resistant training, weight training is a huge one. It does not have to be excessive either. We're talking 30 minutes a few times a week.
Yeah. I think that's a really good point to harp on, is that this type of preventative exercise, you don't have to do it every day, and it doesn't have to be an hour and a half at the gym.
It does not.
Right? It could be 20 minutes even a couple times a week, right?
It's a huge misconception. I think it deters a lot of people, which is unfortunate. 20, 30 minutes a few times a week, you're great. You want to go outside for a walk, take a hike, great.
With your weighted vest.
Yeah, with your weighted vest. I also recommend patients do something like yoga, Pilates, Tai Chi, something that's working on your balance would be something that you would reap benefits from.
Got it.
Yeah.
Got it. Okay, so we've got the exercise. We haven't talked about vitamin D. Let's talk about vitamin D.
Yeah, so let's talk about that. So supplements. I'm sure you're familiar with them as well. So calcium is a big one for me. Patients are always asking, what other supplements do I need to take? I love for my patients to take vitamin D3 with it. It helps absorb the calcium into the bone. It's important.
Well, it actually helps absorb the calcium from the gut. If you don't have enough vitamin D, those cells that line your GI tract can't absorb calcium. I mean, it will also help into the bone, but it's really important for the gut.
I'm saying to put that into the bone, right?
Yes.
So another big one for me is magnesium.
Yes.
I recommend it every day. And then vitamin K.
Yeah.
I ask patients to take it in addition to just help with the absorption of the calcium.
Yeah.
Those are big ones for me.
Yeah.
Are there any that you recommend for your patients?
Those are great. I also usually like to add a little boron and strontium, because those two minerals are really important for some of the cross-linking that happens with bones. But the calcium and the vitamin D are so important.
So important.
And I always harp on, make sure you're getting your vitamin D levels checked. Because without knowing your level, you might not know what dose to take. A lot of people are like, I take 2,000 IUs of vitamin D. Great. If your vitamin D is 17, I'm sorry, 2,000 IUs is not going to cut it. You need to be taking like 15 to 20,000 IUs a day for a little while. Yeah. And then you also want to get it checked after you've taken it for a while, because it could go too high.
Yep,
which I've seen a lot of patients are like, I've been taking this 50,000 IU thing for 2 years, and I check their levels and they're 120, and
like,
then we start to put stress on the thyroid and the parathyroid gland, and that can cause too much calcium absorption. So really important to get those D levels checked at least once a year. If not, and if you're actively taking vitamin D, you might want to get it checked a couple times a year.
Especially post-treatment.
Yes.
So what goal are you having your patients?
I like between 60 and 80.
I was going to say the same. Yeah, I agree. I think this idea of being over 30 is sufficient. It's not. It's not
just
even
not
close.
enough. And the thing about vitamin D, it cracks me up that we call it a vitamin. It's really not a vitamin. It's a hormone.
It's
100% a hormone.
Right.
I mean, it's so important for bone health, what we're talking about today, but it prevents cancer. It, helps with aging. It helps with hair. It helps with skin. I mean, it helps with, mood. Oh, mood is another, like the biggest one.
That's a huge one.
It's the happy vitamin, right?
So I always tell people, and the best way to get it is be outside.
Yes.
Go outside, take the sunshine in, and enjoy it. And if you can, especially in these colder winter months where we're inside, is a big time where I tell patients to check their levels.
Yes. And when you go outside, make sure you're getting like inside of your knees or inside of your arms and back of your knees, because you absorb it more there.
Better.
And so sometimes in the winter when we go outside, the sun's not at the right angle,
but
we're covered up, right? Or you wear sunscreen, which is, we love sunscreen, but sunscreen's going to block your vitamin D absorption.
Yes,
so
it will.
So it's good to get outside.
I could talk about sunscreen all day.
Oh yeah, we want to talk a little about this. Let's hear.
Something I want to tell people is, please look at the ingredients in your sunscreen. I really like using a mineral-based sunscreen, especially for my face and especially for my children. Yeah. Please, please, please look at the ingredients. They're not all.
There's so many crappy ingredients.
There's so many crappy ones that you do not want putting on your kid's skin. Yeah, that's a big one.
Yeah, and if you're putting it on and you're not getting your skin any exposure to the sun without it, one, you're not getting vitamin D, and if you're putting on all these chemicals, you're actually increasing your risk for different cancers.
I know, you're talking about all these endocrine disruptors, right? So that's something I please read the ingredients.
Yeah. So vitamin D is obviously a big one, and if you're someone who finds your levels aren't improving by taking it orally, which is common. We see that a lot. People are like, oh my God, I've been taking this high dose and their levels are still in the 30s. Guess what? There's other ways you can get it. You want to talk about that?
Yeah. So one of the ways that we offer it is by injection. Yeah. So we offer it IM, and again, levels need to be checked pre and post, because you do have a great response by doing it IM. You're bypassing your digestive system essentially and getting it right into your body. So make sure you check it afterwards. Yeah.
But that's a great, easy way. And if you're someone who's not great about taking supplements, or you don't like taking pills or liquids, you can go, hopefully you like taking shots. But
Hopefully you like taking shots.
Really not that bad.
It's quick, it's easy, it's essentially painless. I mean, patients have a great response with it, and they see the effects, so they don't mind it.
Yeah, it's a great way to get levels up. Yeah. Okay, so exercise, we talked about vitamin D. What else? Prevention-wise, obviously the alcohol, caffeine.
Those are the biggest ones. And diet. You really want to make sure that you're getting enough calcium and all these other nutrients in your diet. So you don't have to be drinking milk to get calcium. Yes. There's
so many other ways you can get calcium.
There's so many other ways you can do it. You have plant-fortified milks that have it. You have leafy greens. You have nuts. I mean, there's so many ways to get it. And the same with vitamin D. Egg yolks are a great way. I love eggs. I eat them every day. But there's so many other ways that you can get these vitamins and nutrients. Yeah.
So, I mean, the things we're talking about are pretty simple,
I know,
right?
They are
it's pretty simple. Oh, one, we haven't talked about estrogen. We need to talk about estrogen.
Yes. Okay. So we are seeing it in postmenopausal women. Estrogen has this protective effect on the bones. What I do like for patients to know is estrogen replacement is an option for treatment. Yes. It absolutely is. It needs to be monitored closely. There are risks associated with estrogen replacement, blood clots being one of them. So, I mean, talking to your doctor or your healthcare provider in detail about what is happening and what risk factors you have is a big one. Do you see a lot of patients using estrogen?
We do a lot of hormone replacement therapy here. So, hormones are kind of our big thing we talk about a lot. And if your estrogen levels are very, very, very low, and by that if you're getting checked, if they're under 5, you're going to be at a much higher risk for osteoporosis. And what we talk about when we're doing HRT is, patients sometimes are fearful of estrogen, right? Rightfully so. It got a bad rap in the early 2000s. Not necessarily for the blood class, but most people are like, oh my God, is it going to give me cancer?
Breast cancer, right?
But hormones, when their levels are too low or they're too high, we're going to see problems. When they're at the optimal range, you're not going to be at a higher risk for blood clot, but you are going to be, helping your body not get osteoporosis.
That's why I just have patients, please make sure you're following with somebody like yourself who's going to monitor those levels
checked.
For sure.
But it's a really important piece of the puzzle. And sometimes, obviously your estrogen levels will go down when you're in menopause, but we see a lot of patients that for one reason or another, their system is super stressed and their estrogen levels are really low before they've gone through menopause. And, we don't always use, estrogen replacement for that, but finding natural ways to get those levels up are going to set you up to be less at risk for osteoporosis.
Absolutely. The why of medicine. Right?
Yes. And that's really the key to prevention.
That's really
the why.
The entire thing. It's the why. And there's so many things, like you said, that are free, that are at our fingertips that we could be doing every day. And I'm not sure why we're not.
I think we're just a society of convenience, and we're
I
always
agree.
too busy. We love to
Too
wear
busy.
the busy badge, and no, I'll do that later. I'll get that checked later. But we live in such a cool time where, as you said, we can detect osteoporosis a lot sooner, a lot earlier. We can detect cancer sooner. We can regular screenings are very important.
So important.
So DEXA every 2 years is still the appropriate, right?
Yeah, unless you do have a diagnosis of osteoporosis, we do screen you yearly.
Once a year. Yeah. There's also some really cool testing options. There's a test, I'm forgetting the name of the lab, that it will actually measure like the level of osteoclast versus osteoblast, which will tell you like, is the body breaking down bone currently or is it building it? And that can be a nice thing to do in between your DEXAs to know like, hey, is my protocol working?
Yeah.
Is my body still actively stealing bone, or is it going back to
especially if you're
it?
in that premenopausal stage, right? And you want to know exactly where your levels are. I think that's a great test.
Yeah, it's pretty. I'll get you the name of it.
Yeah, I really love that.
Brain's not working. I'm not remembering things today. But and that and getting your nutrient levels checked regularly. Like we talked about the vitamin D and
the standard panel people are going to their doctor for is just not enough.
No,
it's not even close.
Yeah.
So having someone who's going to check those levels in detail is super, super important. And sometimes there are out-of-pocket costs, but.
Sometimes if you've got good insurance, most of the testing we do at our clinic is, we do it through LabCorp and insurance. I mean, you can get tons of great information.
Totally.
There are tons of other specialty labs that you may have to pay out of pocket for. There's some great, really specialty gut tests where you can tell like, hey, am I actually absorbing my nutrients in the gut, right? Is my gut flora off? There's so many things that, the gut can affect in terms of absorption and in terms of estrogen metabolism too. Like sometimes if your gut flora is off, you might not be metabolizing estrogen correctly, which can cause some problems with hormones, right? So that kind of specialty testing can be helpful, but finding a provider that's going to go deeper with you and do more testing.
And that was really my issue with the traditional medicine sense. I was given 15 minutes to see a patient.
It's just not enough.
It's not enough. I mean, anyone could write a script.
Yeah.
I didn't want to do that anymore.
Yeah.
So that's what I'm really excited about for next year, being able to sit down, have a few patients, get to know them, go to them if they need help. They can come to me and really give them the time they need, because 15 minutes is not enough.
It's really not enough.
It's not even close.
No. Especially if you've got multiple things going on, right? Absolutely. And by the time we get to our 40s and our 50s, when we're having most health problems to begin with, you're going to have more than one thing going on.
Patients feel rushed. It wasn't a good model for me.
Yeah.
And I was very privileged to be able to walk away from that. I do recognize that and do it on my own terms, but it's
funny. I get the question a lot. Patients will come in for the first time, and we spend over an hour with patients, and our lab visits are really long because we run a lot of tests. And they're like, why didn't my doctor run these? I'm like, honestly, partially because if they ran all these tests, they can't go over all of these with you in 15 minutes. No. There's no way to do it. I mean, it takes me a good 45 minutes to go through my 15-page lab report that we run on almost every patient, right?
This system is not set up for that type of relationship. It's just not.
Yeah, and it's unfortunate. I mean, I'm not sure what the answer is, but I think, if you have the means and you can get like an HSA or put money aside that you can spend on whatever you want to spend it on versus what your insurance company deems acceptable.
I think that's why we're seeing a large part of patients, especially the younger ones, are going toward this concierge model.
Oh, 100%.
Because they don't want to feel rushed.
Yeah.
You know, they really want to have that relationship with their doctor again, and that's a way to do it.
Yeah, it really is. Because as you said, osteoporosis, but there's so many osteoporosis, diabetes, cardiovascular disease, they are all 100% preventable.
It's 100%.
Yeah.
So hypertension, diabetes was a big part of my practice.
Yeah.
Women's health was another big part.
Yeah.
We're talking breast cancer screening, cervical cancer screening, and just overall wellness, sexual health. And I didn't have enough time.
Yeah.
And they're so important.
Yeah.
I really wanted to take the time, like, let's talk about your diet. Let's talk about your lifestyle when we're talking diabetes. Let's talk about your other options, because you don't need to take this shot. You don't need to take this medicine. Your body's smarter than that.
Yeah.
But like you said, it's time, it's convenience.
It's time, yeah. And I think, it's always, we usually require our patients to have a primary just so they can go get a physical and go do the things. And if you need something, but I think having someone that's going to think out, and that's kind of my message on the show, is make sure you have a provider that is going to go a little deeper and that you trust. Right? And sometimes it takes a little bit more time in a visit to build a rapport with someone.
And it's unfortunately, sometimes the doctors are stuck in that rat race, right?
Yeah.
They come out of school with these ginormous loans.
Yeah.
They need a way to provide for their family. They take these jobs where, unfortunately, you don't have that type of time with your patients, and it sucks.
Yeah, it does.
It sucks. So, I'm really excited about that next chapter.
Yeah. So talk a little bit about the IV therapy that you guys are doing.
So this year we opened up Revitalive. It's located in Westminster, Maryland. I'm super excited about it. We've had such a great response so far.
Yeah.
IV hydration has taken off, I would say. Wouldn't you
everywhere.
agree?
Oh my gosh,
it's everywhere, and for good reason, right? We have this really rapid absorption directly into our bloodstream. We're bypassing the gut. We're seeing faster recovery times, and it's really used for everybody. I mean, you have athletes who use it post-recovery from workouts. You have post-surgical patients using it post-recovery.
Oh, it's fantastic.
You have patients who, let's say they have Crohn's or something where they're depleted severely. This is a really fast recovery for them. And the biggest thing I see is these hangover cures, right? So my Myers cocktail does not stay on the shelf very long. It flies off the shelf. And that is, is that your most popular as well?
Probably. We do a lot of really high dose vitamin C because we're using it usually to treat things like EBV or Lyme. And if you go upwards of 25 to 50 grams of C, I mean, you can get so vitamin C is fantastic. Everyone listening probably knows. You can only take up to like 5 or 6 grams orally without having crazy diarrhea. Sometimes you get a little higher than that, but you need a lot more you need to really saturate the cells if you want to have the antibacterial, antiviral action. It's fantastic for shingles. Like if you've got an acute shingles case or any sort of viral thing, high doses of vitamin C just like wipes it out. So that's probably the most common thing we're doing. We don't do a lot of the hangover stuff when we can, but
we do.
Yeah,
which
is a fantastic thing.
So we'll do a lot in office, but I actually do a lot of house calls.
Oh, that's great. Oh, that's right. You're doing mobile visits.
So we are mobile. So we'll come to you, and I'll see a lot of them. And it's not even just for hangovers. People just want to say, "Hey, I had a long week.
Yeah,
I had a busy weekend. I didn't hydrate.
I'm about to travel.
Yes,
right?
I'm about to travel. I don't want to get sick. Or I'll just see like a bachelorette party. They'll sit around. I'll get their IDs.
So
bachelor party, and it's just fun. It only takes an hour. What I tell patients, it's 1 hour. All you need is the IV, and it's just so relaxing. But it's been received really well, so I'm excited about it.
That's great.
Yeah, and I'm really excited to add it to my practice.
Yeah. What's your personal favorite?
The Myers,
combo?
for sure.
Oh, you love the
for sure.
Myers.
Like I said, even if you're not hungover, it's great.
Yeah.
Because it contains B.
It gives all the B vitamins.
C. It contains magnesium.
Yeah. With the IV magnesium. My favorite is I like 25 grams of C for the immune stuff. I like a little bit of magnesium, and I love NAD. I don't know if you guys are doing NAD.
Yeah.
I feel like the magnesium kind of chills you out. The NAD makes you super focused.
Nice and I'm seeing a lot of patients ask for glutathione.
Yes.
That's another one, an antioxidant that we're seeing a big request for. So it's been really fun, and getting to know those patients and seeing really an immediate response.
That's what's so cool about it. I mean, and I love oral supplements. They're great. Sure. But again, what I said earlier, if you're not absorbing things well, this is a great way to bypass the gut, so you can get higher doses of things, and your cells are going to get more saturated, which is what we want when we're trying to affect change with a nutrient.
Yep. So especially as we enter this cold and flu season, right? Yeah. So I'm infusing zinc and thiamine. Yes. I had a few COVID patients come, and literally bounced off the chair. Like they were ready to go. It's like, you still need your mask. You're not recovered yet.
You're not right. But it's really, the studies looking at vitamin C and vitamin D with COVID recovery and preventing long haul COVID is fantastic. It's
fantastic.
Yeah.
Yep. So just more, the importance of that vitamin D and C.
Yeah. It's a great. I like the pre and post surgery too. Is
so we're
really
seeing
great.
Shorter recovery, shorter hospital stays.
Yep.
And there's
bruising too. I feel like if you're getting any sort of like plastic surgery and cosmetic stuff or any surgery and you're worried about bruising, the vitamin C before and after can be so helpful for reducing
and there's really no downside.
Yeah, there's really no downside. Unless you don't like needles.
Unless you don't like needles, but really.
But you can get over it.
You can get over it. Yeah. I mean, there's really no downside. It takes, how long is your vitamin C infusion?
Usually like an hour and a half because it's a little bit higher. But usually it's under an hour for most of the other things.
Yeah, most of my infusions are about an hour.
Yep.
It's really 1 liter bags. It's not taking that long.
Well, also, let's talk about the hydration piece of it too. I mean, the nutrients are fantastic, but it's so many of us are dehydrated.
So many. We're definitely not drinking enough.
So if you travel, if you drink alcohol, if you take meds, those things are all going to speed up your body's elimination of magnesium and water.
Yep.
So getting one of these like a liter of fluids, feel amazing just from the
liter. Sometimes
fluids,
I'll just say like, do you want to just get some fluids?
Yeah.
Especially those heavy workouts and you're worried about rhabdomyolysis or anything like that. I'll infuse 2 or 3 liters, and they feel great.
Yeah,
and like I said, no downside.
No, there really isn't.
There really isn't. So I really think I'm happy that it's getting as much attention as it has.
Yeah. It's funny. We have a good a referral place that we send they do more like specific IVs locally, and I remember 5 or 6 years ago they were like the only people in town, and people were like, "Wait, what are you doing?" But now they're like, they're popping up everywhere, which I think it's great. I think it's so fun. I feel like when I travel now, it's like easy to be like, "Oh, I'm gonna go find an IV place," and I know you can usually find a mobile one to come to you.
Totally, and so many age groups, right? This spans programs around so many ages, and people just love it.
Yeah. Like I said, it's a really cool time to be in medicine.
It really is.
Agree?
I'm really, really excited about what the next few years will hold.
Yeah. I think we just keep getting more sophisticated. We get more testing things, and people are into it more.
Yes.
Like, I've been practicing, this naturopathic medicine for 12, almost 13 years. Okay. And when I first started practicing, people were like, wait, what? Mm-hmm. You do, what is that? Are you a quack? What's going on? What is that stuff? But now people are like, oh, really? That's so cool. Tell me more about it. And they'll rattle off a list of questions. I'm like, I'm going to point it. But right, like people are really, I think COVID spurred an interest, right?
Everyone I think people are just getting disenfranchised with the current state of medicine.
Yeah. Yeah. Frustrated.
You call your doctor's office, you can't get in for 2 weeks.
Yeah, or 3 months.
Or 3 months.
Specialist, right? And if you find something and you're scared, right? And then you get there and they spend 15 minutes and you're like,
and
wait,
then they're
what?
15 minutes. So, I think it's a combination of all those things.
Yeah.
I'm excited about that.
Yeah.
And I'm seeing it at the gym too. I'm seeing younger and younger people there. I'm seeing a lot more women there.
Yeah,
which is great. And I think just, information about protein, coming out, like how beneficial it is for you. People are just getting into it.
It's funny. I've always mostly treated women. In the past 3 years, have seen an influx of men coming into practice, which men don't usually love to go to the doctor.
Men hate the doctor.
But I feel like men are listening to podcasts. They're really into health. And they're like, okay, I want to come. I want to find out how I can prevent this. I want to find out how I can optimize my health. And so I think it's definitely...
What would you say your biggest age group is here?
That's interesting. Probably 5 or 6 years ago, it would have been maybe 35 to 55, but it's a lot younger now. I've got so many patients coming in their early 20s, late 20s that are like, mostly women. They're like, I don't want to take the birth control pill. I've got anxiety. I've got hormone problems. I've just been told to take an SSRI and a birth control.
The easiest thing, write a script.
Yeah, and I don't want to do that. I feel like something else is going on. And we also treat a fair amount of or perimenopause and postmenopausal women. So, that age range is as well. But yeah, it's shifted a little bit, which is interesting.
That. Yeah. So my rheumatology practice, we see a large population is over 65, right? But unfortunately, we're seeing some of these diseases creep into those lower age ranges, and it's unfortunate.
Yeah. I think the level of stress that our society has been under over the last 4 to 5 years is really like I've seen an uptick in autoimmune diseases in my patients, Hashimoto's, RF, all kinds of joint stuff. Also, the influx of tick-borne diseases has been off the charts. We diagnose so many cases of Lyme disease, and Lyme, you guys know I talk about. I think this summer
was like a huge.
Oh yeah, I mean I diagnose at least 3 or 4 cases a week, which I'm not an infectious disease practice. We specialize in hormones, but oftentimes my patients come in, and you guys know I've talked about this on the show before, and they'll be like, hey, my hormones are out of balance. I'm having all these hormonal symptoms. And I screen everybody for Lyme now because even if they don't have the typical symptoms, and sometimes I have these women that are having hot flashes, insomnia, brain fog, which we think about those, and sometimes maybe a little bit of joint pain or muscle weakness or fatigue, and you're like, oh, that sounds like menopause, or that sounds like perimenopause. But we run their levels, and guess what? Their hormone levels are actually normal. But they have Lyme. We treat the Lyme, and all the symptoms go away. I mean, I'm making Lyme treatment sound a little simple. It's not a simple treatment. But when we do get rid of these internal stressors, which is what I call them, it can affect how the body can then relate to hormones, right?
It's all related. I mean, as you said, the gut and health it's all related. But yeah, I am excited about where medicine is headed.
It's definitely really cool.
I think people are more aware of their exercise. I think people are becoming more aware of their food.
Yes.
Which we know is a huge part of it, and it's going to be good.
It is going to be good. So, okay, tell us where people can find you.
Okay, so I am located in Westminster, Maryland. Okay. Like I said, we are mobile, so we serve all the counties, and we are called RevitaliveMD.com. Cool. And you can find me on Instagram, Dr. J. Militello.
Awesome. Yep. And if someone is not local and they want to just learn a little bit more from you, they can follow you on Instagram. And check you out?
Yep. Okay. Send me a DM.
Fantastic.
Yep. Thank you so much.
You're welcome. Anything else you want to add?
No, this was so fun. Okay. Thank you so much.
Cool. You're welcome. Thanks for being on. Thank you guys for listening. We'll see you next week. Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media to find more helpful tips and information. You can find me at Dr. Kinney on all of the platforms. And please be sure to subscribe and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.